Well, I'm joined today by the former Surgeon General here, Dr. Jerome Adams, and I'm also joined here by a good friend of mine here, Dr. Will Humphries. And we got some questions for you, Dr. Adams. I've never interviewed with two doctors on before. My wife said to me this morning, she goes, finally, we can get something done around here. So,
Well, not just two doctors, but two Black male doctors, and I think it's appropriate to start off by framing this conversation around the fact that unfortunately there are fewer Black males graduating from medical school today than there were 40 years ago, and I think that's an important uh, fact that we all need to understand and acknowledge. And it's not just a matter of these individuals not getting the opportunity, but studies consistently show that you get better care when you're taken care of by someone who you can relate to. And so the care of Black people, and particularly Black males, is going to continue to lag the rest of the country until we can get representation amongst doctors that equal the representation in the population. So I didn't want to hijack the conversation right off the bat, but very important that we have these conversations and that we acknowledge how unfortunately rare it is to have two Black doctors in the same place at the same time.
Dr. Adams, I got to be honest with you. I'm a big fan of yours, so I'm biased, man. I want to be very clear about that up front here. So I always feel like I'm learning stuff when I'm around you, which is why I love interviewing you. So I got to ask, why do you think we're seeing that 40-year decline from both you and Dr. Will here? Why are we seeing that, man?
Well, there are a number of reasons. Some of them, quite frankly, are cultural. It is. I've got two boys right now. You know, when it's much cooler to go out and say I'm going to be a basketball player or I'm going to be a rapper than what it is to say that I'm going to be a doctor. But I think just as importantly, unfortunately, it becomes a self-perpetuating cycle. You've got to see it to believe you can be it. And I often tell folks, many folks who say, quite frankly, let's put it out there. How could you work for that administration, that man? And I tell them, the first Black doctor I ever met in my life wasn't until I was in college. And it was another Black neurosurgeon. It was Dr. Ben Carson, who I met at an event in Baltimore, Maryland. And up until that point, I never considered that I could be a physician, believe it or not. It wasn't that I didn't have the aptitude. I had a 3.9 GPA and was second in my class, but I just never thought I could be a physician. And so we need more role models out there. We need people to see it to believe that they can be it. But there are many other reasons. Too many of our Black males out there are criminalized at a very young age. Yeah. So you've got kids in middle school and elementary school being suspended, being arrested, having marks on their record, which then make it difficult for them to pursue certain pathways further on down the road. We prevent them from being doctors when they're in second grade, quite frankly. And so many different reasons out there. But Dr. Humphries, please jump in. What are your thoughts on this from your perspective?
So this is a very interesting, I don't know if he set this up like this. So my story was, I went to high school in Decatur here in Atlanta in an inner city school. And I had a counselor that kind of invested in me. And I did not even know what a neurosurgeon was until I was in the 11th grade. And someone sent me to a conference and I got to hear a neurosurgeon talk. Guess who that neurosurgeon was? Ben
Dr.
Carson. Right. And so once again, I think what it highlights is that exposure is extremely important. When you're trying to decide who you want to be and what you want to be and how you want to, forge out your way in life. And so I think exposure is really important. We have to have more people seeing African-American male physicians in different spaces and normalize that and know that that's not something where you have to be some weird esoteric thing. You can come, you can go to high school in Decatur and still do that. And I think that's one thing. I think the second thing is cost. If you think about the amount of money that it costs to go to a 4-year institution and then go to a 4-year medical school, right now you're looking at coming out, you're going to be, you're owing maybe $500,000, $600,000
yes,
just to get a degree. and that's not, you haven't even matched. You're not even licensed to be a doctor yet. You just have a piece of paper. And so when you take in the opportunity cost that comes there are a lot of people who may be talented enough and driven enough to do that work, but they say, you know what, I can start working at 25, go into an investment banking, and by the time I'm quote unquote a physician, I would have been out in the market making $200,000 a year. I've already built some wealth, and now I'm on my second business. And so I think if we can find ways to expose kids to and normalize that, being a physician is something that's attainable, that's number one, but also get to the root of what is a big barrier, and that's the cost of college, and also the cost of medical school.
And one more thing that I would highlight, and I think it's important to highlight it with Dr. Humphries there representing Morehouse. What you also have seen over the last 40 years is less promotion and support of HBCUs. So 40 years ago, the majority of Black professionals were coming from HBCUs. They were supported by HBCUs. And that's not just doctors, that's lawyers, that's businessmen. And unfortunately, we've seen less and less support of HBCUs. We've seen, quite frankly, a lot of the elite academic institutions cherry pick some of the folks who otherwise would have gone to an HBCU. And I don't begrudge anyone who says, I want to go to Harvard, I want to go to Yale, but you end up not having that concentration and that support that folks traditionally have had to pursue these types of careers. And so I think it's important that we support the Morehouses, the Meharys, the Howards of the world, if we want to see more Black people and specifically Black males going into medicine.
It's a good point.
Guys, can we talk about just Black health in general? Where do you see things at today? And why is the disparity so wide? And it seems to be growing more so of a disparity between the haves and the have-nots and culture. Why are we still lagging behind?
Well, we could talk forever on this, each of us, but I'd say that there are two important factors that people don't always think of that I want to highlight. One of them is trust. Without trust, you have Black people, and again, Black men in general, who are afraid to go to doctors, who feel like it is useless to go to a doctor because no one is going to listen to them, or they're going to misdiagnose them, or they're going to blame them. So that lack of trust, and people often talk about Tuskegee, talk about Henrietta Lacks, but this lack of trust also is reflected in everyday reality right now. When you go to the emergency room and you say you're in pain as a Black man and someone thinks you're seeking opioids, or when you get turned away from care for any number of reasons. When we look at Medicaid programs in many states, particularly in the South, they exclude Black men. They say, unless you have a child, then, and unless you are, unless you're a woman with a child, we're not going to put you on Medicaid. So they're actually numerically and statistically excluded from access to the healthcare system more so than other people. So trust is one important part. But the other aspect that I want to highlight are social drivers of health. Only about 20% of your health is determined actually by your access to traditional healthcare, to doctors, to hospitals, to neurosurgeons like Dr. Humphries, or anesthesiologists like myself. 80% of your health is determined in your community. It's determined by transportation. It's determined by access to childcare. It's determined by your ability to have a good paying job. These things, your access to fresh fruits and vegetables that are affordable and safe places to exercise. That is 80% of what determines your health. And we know, unfortunately, that Black males disproportionately have less access to these social determinants or social drivers of health than anyone else out there. So those two things conspire: lack of trust and lack of opportunity to make healthy choices to promote, unfortunately, poor health among Black males. Dr. Humphries?
No, I agree. I think, access for us is one that we see And access manifests itself in a lot of different ways. Sometimes access is, once again, I can afford to go to the doctor, but I'm not going to go because I don't trust them. Other times it may be access is, I have insurance, but my lifestyle, I traditionally have not gone to the doctor, and no one that I know goes to the doctor. And so we tend to think that we have all of these things that run in our family, like high blood pressure and diabetes. And really, it's not a genetic predisposition. What you have inherited is a lifestyle. And so I'm very big on lifestyle, but you know what? It's hard to change your lifestyle if you can't do that from a socioeconomic standpoint. If you can't afford to eat right, if you cannot afford to go to go to places where you have, better health, or to join a gym. So I think access as it pertains to healthcare, but also access as it pertains to lifestyle changes that will actually move the needle are really important. And then, like you said, I think trust. There are a lot of people who look like us who don't trust. But you know what? So those are things I think that are controllable, but also there are things within the hospital system that exist. Like, for instance, there are recent studies that have come out that even among African Americans who present to the ER with a stroke, and they're a candidate for like a mechanical thrombectomy, that's a procedure where we go up and take out clots. African Americans, for reasons that we're still trying to figure out, are less likely to get that procedure. So yes, there are things that the patient can control, and there are things that you can control from a societal standpoint. But I also think that there are system-related things that are baked into how we provide care that also impact us. So it's a two-edged sword.
So I actually gave a lecture to an engineering class recently where we talked about the intersection between engineering and health. And one of the most famous engineers in history is a gentleman named W. Edwards Deming. And W. Edwards Deming said every system is perfectly designed to deliver exactly the results that it gets. And he also said that a bad system will defeat a good person every time.
I like it.
So we absolutely need to empower individuals to make healthy choices. But I love that you highlighted, Dr. Humphries, the fact that no matter how much we empower individuals, if the system is set up against them, then they will continue to struggle. And unfortunately, we see it with neurosurgery and Dr. Humphries' specialty. We see it in cardiovascular care, where Black men and Black people are less likely to get cardiovascular interventions. We see it in orthopedic care, where Black people are less likely to be offered a knee surgery despite coming with the exact same symptoms as their white counterpart. So there is ingrained bias and systemic racism in the healthcare system that we have to acknowledge, because if we don't acknowledge it, people will continue to get poor care, but then it'll be a vicious cycle of then lack of trust, and then they won't come in for the care, and it just piles on itself.
Two Black doctors here. How did you guys do it? That's kind of been one of the questions I've been wanting to ask, and I've tried hard to think through how to ask that question this morning, getting ready for our time. But how did you do it? What advice would you give to the 20-year-old or 15-year-old who is going, man, I see this, I think I can get there, but how did you guys do it? Man, fair question.
Dr. Humphries, you want to start?
Yeah, so for me, I think it was a combination of things. Like, to your point, you were talking about before, HBCUs. And I'm not one of those people that thinks that all Black people should go to HBCUs. But for me, when I looked at where were the majority of people that looked like me coming from that were going to medical school, there were two schools that were really at the top. It was Morehouse, it was Xavier, and it was also Howard. Right. And so I chose the school that I thought was the best fit. So I tell people all the time, number one, along every journey, you have to figure out what are your strengths and what are your weaknesses, and where do I fit into a place where I'm going to get the training, but also the nurturing and the mentoring. A lot of people just think it's getting good grades. It's the network that you develop. It's the people around you. It's who can pick up a phone and make a phone call to get you to where you want to be. So I think number one, you need to make the grades, but also you need to start building the network and being very strategic about figuring out where's a good fit for you to be successful. So that's number one. I think the second thing is understanding that it's just not enough to be smart. You have to have a story. And so, I was able to sit on admissions committees, both for residency as well as when I was in medical school. And what happens is they put up a PowerPoint of your person and say, all right, Jerome Adams, who is this guy? Who knows him? And so what you have to do is very quickly be able to walk into a room and have your story resonate. So if you don't know who you are, it's going to be hard for you to tell somebody else when you're competing with good grades and good letters of recommendation why you deserve that spot. So knowing who you are, being able to tell your story, but most important, figuring out who you are so you can figure out what fit you need. And then the mentoring and the networking component, I think, are very important. There are a lot of people that are smart enough to be doctors. I think a lot of people fall short, particularly African Americans, because they don't know how to play the game along the way. That's
exactly.
Yeah.
I love that. I love that. And what I will say about my success will largely reiterate what Dr. Humphries has already mentioned. I think one important aspect is that you have to believe. And fortunately, I had two parents who were school teachers who really instilled in me that you could be whatever you want to be, and so that wasn't a barrier to me. But I say to young people out there, I know people who were doctors who got F's all the way through elementary school. I know people who were doctors who grew up poor as poor could be. You don't have to be Cliff Huxtable
right.
for the Cosby Show
Right.
to a doctor. Try to seek out mentors and role models when and where you can, and also in turn be a mentor or a role model to those who come behind you. So there's a lot in that mentorship and sponsorship pathway that really can contribute to your ability to be successful. And then I'm glad that Dr. Humphries did say, HBCUs are unique because of the collection of talent and support that they have, but you can find that at other places. You don't have to go to an HBCU. So I actually went to University of Maryland, Baltimore County, which is a school that has produced the largest number of African American PhDs,
yep.
outside of an HBCU, and their program really was designed around bringing us together on what was a traditionally very white campus, but creating that cadre of support for us to have throughout undergraduate and beyond. And we've got a Surgeon General. We have the inventor of the COVID vaccine, Kizzmekia Corbett, who's a graduate. We have Rhodes Scholars. We have any number of prominent Black individuals who are now amongst our alum. And so that feeds on itself and builds. But you need to find a place where you're going to have a support system and not just, a scholarship for school that puts you out there by yourself and leaves you to sink or swim.
Dr. Hrabowski, I have a really good friend who went to UMBC, who went to med school with me at Duke. And I mean, he's a really prominent, he's an MD PhD and is a really prominent neuroscientist right now. Humphries Zrirasa, he always kills me when I butcher his name, but presidential scientist doing really well. And so that's another, I tell people all the time when I'm talking to students, like schools are kind of like shoes. It's like fit, right? Mm-hmm. It can look good on paper. It can look good in terms of rankings. It can look good, but when you put it on, if it doesn't fit you, it's not going to serve the purpose. I know a lot of students have gone to HBCUs who did not do well because it wasn't a good fit. I know people that have gone to Harvard, Princeton, Yale, didn't do well. I know people that have gone to University of Texas, on both sides, mm-hmm. well and not well. And it wasn't necessarily a reflection of their talent or the school. It's just that it wasn't a good fit.
I'm stealing that one. Schools are like shoes. You got to find the right fit. I like that.
That's a great one. Dr. Adams, last question here, guys. I'm sorry that's his last question. I could do this all day, but I want to stay true to your time frame here. When people ask me, I've interviewed you twice now, third time now, they ask me, how do you work with a hard boss, man? I give them your advice, and I have given them your advice. And I think I can honestly quote it myself, but I will not for our time together here. I think we could all say you worked for a unique, hard former president, man. Mm-hmm. I'll leave it at that. How did you do it? How did your faith guide you?
I want to hear this.
How did you get through, man?
Well, my situation was very public, and so people perceive it as being particularly hard. But Black men all day, every day in particular, deal with difficult bosses.
Yeah.
They deal with people who have bias against them. They deal with people who put up obstacles to their success. That they deal with people who try to take from them unfairly and who don't give to them fairly. And so I'll be honest. I mean, that's just life. Mine was just on a bigger stage. And so how did I deal with it? I go into every job and every situation realizing there are going to be guardrails. And what I want out of a situation is transparency and awareness about what those guardrails are going to be, but also a real recognition of what the opportunities are going to be. So yes, I had to work for a difficult boss, but I also had the opportunity to go out and share my story and to be a role model for that little kid out there who may not have ever seen a Black doctor in their life, much less one standing next to the President of the United States, and to advocate for social drivers of health as I did during the pandemic. And so every day I got up, I asked myself, did you do more good than harm yesterday? Yes. Do you feel like you're going to have the opportunity to do some good today? Yes. All right, keep on going. But I had someone tell me once before, when you go into these high-level jobs, and I think it's not just high level, it's any job, understand what your guardrails are and have your resignation letter written on the first day. And really understand, okay, this is what I'm here to accomplish. Here are my guardrails, so that you don't have to negotiate it in the moment. Because in the moment, there's emotion going on. And it's really hard for the logic to come in and say, okay, I'm really ticked off right now at my boss, but I can achieve more by staying than by going. You want to have thought about that beforehand. And if you do that, then you'll be able to make smart decisions about jobs. And the other thing that I'll just close with is not everybody is a Christian, but I am a Christian. Yeah. And I believe in the power of prayer. And I believe that when you're struggling, if you ask for help, whether it's from God or whether it's from your support system, and I had both, you will get good answers back. But if you try to do it by yourself, it's going to be very difficult to make good decisions, and you're going to feel very lonely.
Man, this was fun. Man, I should have been a doctor.
Nope.
No. Not too late. Not too late.
It is too late. Dr. Adams. I'm joking, man. Thank you both so much, man.